Cassie, and we're for the opposing side of physician-assisted suicide, and we think that California should keep it illegal. So first off, if physician-assisted suicide were legal, it would violate every doctor's Hippocratic oath. Upon receiving a medical degree, each doctor is required to take a Hippocratic oath, which says, among other things, first, do not harm. It also states, I would neither give a deadly drug to anybody if asked for it, nor will I make a suggestion to this effect. And that's according to UIC.org. Assisting in suicides would be a violation of that oath and would lead to a weakening of doctor-patient trust. The oath was created in part so patients could be reassured that doctors only wanted to help them and not hurt them. A weakening of that oath may cause patients to wonder. Secondly, doctors could possibly misdiagnose a patient who is not terminally ill, or even a medical miracle could occur. Doctors make mistakes just like any other person does. A wrong diagnosis could lead to the suicide of a savable person, and in some cases, remarkable recoveries could occur. An example that I found was of a man named Tom Goff, who was diagnosed with stage 4 colon cancer in 2009 and had 6 months to live. 8 months later, he was admitted into Kappa, which is a Turkish university teaching hospital, where he was operated on by a doctor named Turker Bey. As a result, the main primary cancer tumors in his colon and bladder were successfully removed, along with 30% of his intestines. An analysis revealed that his intestines contained 0 cancer cells. The surgeon admitted that Tom Goff had gone from terminally ill to completely cured in the space of 8 months. He admitted that it could have been an improper diagnosis or even a miracle, and that was in Gazette Times. Lastly, physician-assisted suicide could lead to an increased number of suicides, which in essence demeans the value of life. To sanction the taking of human life is to demean life itself. If physician-assisted suicide becomes legal, the disabled, terminally ill, chronically ill, and elderly would be the first to feel the pressure to die. According to a legal document filed with the BC Court of Appeal, the current system is to protect the vulnerable who might be induced in moments of weakness to commit suicide. In addition, there is a danger that many people would use physician-assisted suicide as a means for an escape of external issues. For example, an elderly individual who doesn't want to be a financial or caretaking burden might choose physician-assisted suicide. Currently, physician-assisted suicide is illegal in California. In 1997, the U.S. Supreme Court handed down 2 cases central to physician-assisted suicide, which are Vacco versus Quill and Gregory versus Glucksberg. In those cases, the court determined that there was no constitutional right to physician-assisted suicide. However, the states of the Union could decide the matter for themselves. As a result, Oregon, Montana, Vermont, and Washington have legalized physician-assisted suicide, while the other 46, including California, have kept it illegal. And I found all that in constitutioncenter.com. Stephanie had stated that the only way is to do physician-assisted suicide, but we think that the alternative is palliative care, which she said is ineffective. However, palliative care is done by trained professionals, and it addresses all aspects of the patient, including their physical, emotional, spiritual, and social needs. Palliative care focuses strictly on the end of life and leans less on technology in order to improve the patient's quality of life. It brings a peace to the family and friends of the patient and empowers the patient to come to terms with the end of his or her life. Overall, physician-assisted suicide should remain illegal so we don't get to a point where we should spend more time looking for a way out of life than for a way to sustain life.